I'm here, too, to join in advocacy for PAYGO legislation that is going to come before the House floor this week. You know, PAYGO is what it sounds like. If we have a new program, we have to find a way to pay for it, either through cuts or revenues. If we have a proposed tax cut, we have to find a way to pay for it, either in a reduction in programs elsewhere or a shifting of priorities and spending. And it's a very simple, elemental approach. If you're going to if you're going to buy something, you've got to pay for it. Families know it. In their family budgets, they have to do it all of the time. And government really is no different. It's no different because in the end, if we borrow money, at some point, we're going to have to pay it back. And we've gotten into a habit in this Congress of not paying for things. In some cases, expenditure programs, in other cases, tax cuts. And we've had some back and forth this morning with our friends on the other side of the aisle. And without getting into the blame game, which doesn't get us anywhere, there is an irrefutable fact. And that is that in the past 8 years, with the tax cuts, with Medicare Part D that was not funded, with a war in Iraq and a war in Afghanistan on the credit card, we have gone from the largest surplus in the history of this country to the largest deficit in the history of this country. And what it means is that our kids and our grandkids are the ones who are going to have to pick up the tab. And aside from the fact that that's obviously unfair, and none of us want to pass on the burden of debt for our spending onto others, it really is going to restrict what it is that generation can do to meet its own challenges, to educate its kids, to provide health care to its kids and themselves, to provide for the national defense. And we have the capacity to impose on ourselves a rule that families have to impose every month when they sit around the kitchen table, going over their checkbook and trying to figure out how at the end of the month they're going to make the checkbook balance. And that is to accept the burden of the discipline of paying for our tax cut proposal or our spending proposal when we make the proposal. Voters know that. They want fiscal responsibility. And in fact, their concern about the deficit, rightly, is at the top of their agenda. And we've had extraordinary circumstances here that have required extraordinary actions, with the economy going off the cliff, the stimulus spending, with the legacy of a war in Iraq and in Afghanistan on the credit card. We have restored truth in budgeting so that those two things, the wars in Afghanistan and Iraq, are now on the budget. So it's painful because we're seeing in black and white what the cost of those enterprises are, and we know that we're going to have to pay for them. We're not trying to hide it. We're being direct. The American people are entitled to that candor, and they're entitled to have us respond by making certain that we, going forward, adopt pay-as-you-go principles. You know, it's not just good in theory, and it's not just good for conservatives or liberals. It's good for everybody. You know, I'm a big supporter, as I think most of us are, that in this country we achieve the goal of having all of our citizens covered by health care. Every citizen should be covered and have access to health insurance. Every citizen should help pay for it. And if you lose your job, you shouldn't lose your health care. But the President has acknowledged that, worthy as that goal is, we must pay for it. And the health care bill that we're now considering has to be paid for. What a difference from what happened with the prescription drug program that was largely put on the credit card and is not able to sustain itself or pay for itself. One of the reasons it's so important to have PAYGO is that it imposes the discipline on us to kick the tires of a program. You know, health care is a great example. We need it. We have good health care in this country, but the cost is going up at 2 or 3 times the rate of inflation, 2 or 3 times the rate of profit growth, 2 or 3 times the wage growth. So people are falling behind. The middle class is getting squeezed. They're facing higher copays and deductibles. By adopting PAYGO, it is forcing us to look at our delivery system and ask ourselves, how can we reform the delivery of health care to make it more efficient, provide more value for less money? And in fact, there's examples after examples of how we have, in many cases, excess utilization. So this bill is going to be helpful to all of us, and it's very important that we pass this legislation. Thank you, Mr. Speaker, and I yield back the balance of my time.